welcome to Moms on a Mission. We recently had Mike Lindell on from MyPillow, and he was sharing about the high quality products of his slippers, pillows, towels, and sheets, and yet they're priced super affordably for us. So if you like what you hear in here, if it's a blessing to you and it helps you in any way, please go to mypillow.com and purchase something that you would need. He has so many products, and just type in the code MISSION. And Mike says that now it's not 66% off. You can save up to 80%. So go to mypillow.com and type in the code MISSION to save up to 80% off. And you're supporting a patriot. And then you're also supporting our Moms on a Mission podcast. And we would be so grateful. Also, we'd love to hear from you. You can email questions or comments at moms@momsonamission.net. That's moms@momsonamission.net. Our guest today has experienced a nightmare from which she never woke up. Her husband, Woody, was a victim of a deadly side effect from the drug Zoloft. She is the very reason that there's a black box suicide warning on the SSRIs today. She's been a consumer safety representative on the FDA drug approval panel and is vigilant regarding safety. Please welcome to Moms on a Mission, Kim Witczak.
Hi, thanks for having me.
Thanks for coming on, Kim. And we were talking before we started recording lots of good things. And we were just talking about how, a lot of us are connecting nowadays to stand up for, these causes and these things that we feel like God has told us to say yes to. And we just want to encourage, even before we get started, that if the Holy Spirit is speaking to you, if God is speaking to you, just to stand up and say yes. And that one yes of obedience, how it can affect thousands and thousands of people. And so that's what we're going to talk about today, Kim's story and how she handled this devastating nightmare in her life. So Kim, welcome to Moms on a Mission. And please share with us a little bit more your story and who you are and what you do.
Sure. Well, first of all, I would like to call myself an accidental advocate because I never chose to do this drug safety work, but sometimes our greatest purposes call us forward. And August 6, 2003, which is almost 20 years, or it's actually over 20 years ago, I received a phone call from my dad that changed the trajectory of my life. I was out of town on business. I was out of town on business, and I hadn't heard from my husband of almost 10 years, Woody. And he called to tell me that Woody was found hanging from the rafters of our garage, dead at age 37. Woody wasn't depressed. Woody had no history of depression or any other mental illness. He had just started his dream job with a startup company and was having trouble sleeping, which is not uncommon for entrepreneurs. And he had, went to the doctor because he was a guy who always needed like 8 hours of sleep. And so he went to his GP, his family doctor, and was given the antidepressant Zoloft and was told that it would take the edge off and help him sleep. And, Woody was this guy who was a big athlete. He loved life. But he looked at doctors as like Humpty Dumpty because, they always put him back together. He got, hit in base, somebody came down and bit his head in basketball. So he had to have stitches. He had something with his knee. So he had arthroscopic surgery. So anything that the doctor said, they put him back together. That was kind of his, belief in doctors. Right. So Wood, went and got put on this antidepressant. I happened to be out of the country on a production. I'm in advertising and still am. And I was on a production down in New Zealand. So I wasn't there when Woody got put on this drug, and he was on this medication. He was sent home with a 3-week sample pack that automatically doubled the dose after week 1 to week 2. And, I was having the time of my life, and here Woody is, slowly, deteriorating before our eyes, without him knowing. But I'll never forget when I got back from my shoot, I walk in our back door, and Woody, and I was waiting for him, and he came in, dropped his bag at the back door, completely blue dress shirt, in a white t-shirt underneath, sweating through, fell to the floor, and kept rocking his head. Kim, you got to help me. It's like my head's outside my body. You got to help me. And he's bawling. And he's like, I drove around all day. I don't know if I can handle one of these again. Calmed him down. We prayed. We did yoga breathing, calmed him, and eventually called his doctor and told him. And the doctor said, you got to give the drug 4 to 6 weeks to kick in. And so never once did we question the drug. Woody lasted another week. Every night he'd come home and he'd be like, Kim, what do you think about hypnosis? I'm going to beat this feeling in my head. Kim, what do you think about acupuncture? I'm going to beat this feeling. Everything was beat this feeling in his head. And so, and I remember even saying, like, Wood, I don't know if your job's too stressful, this new business, quit. I had no idea. And so it was my busy time of year. We're in production. So I had to travel again. And it was I was out of town again, and I called Woody, and we both, by the way, traveled a lot. So we always traveled. So this was not anything out of the norm for our relationship and being together for 10 years. And anyways, I call him and I hadn't heard from him. So finally, that's when I, all day called him on Tuesday, August 6th. And eventually I asked my dad at around, 9:00 to call where I was in Detroit to go check our house. Little did I ever expect to get that call that my dad called to tell me. And in one moment, I remember like my life flashed before me. Everything that I knew, everything that I thought, my dreams, with one phone call changed. And that night when he died, obviously my dad was shocked. I mean, that would have been the last thing any of our family would have been expecting. But we had, he eventually called, got my mom and my sister and her husband came over. But the coroner called me when I was in Detroit and wanted to know if Woody was on any medication. And the only medication Woody was taking was Zoloft. And she said it might have something to do with his death, and she was going to take it with her. And the other thing that was interesting, the same day that Woody was found, was the front page article of our newspaper that said the UK finds link between antidepressants and suicide in teens. And so both of those things happened on the same night that Woody was found. And I remember thinking intuitively, every part of my body was like, there is no way Woody killed himself. No way. Like, something doesn't make sense. This was a guy who loved life, we were just talking about starting a family, and we just booked our 10-year anniversary trip. I'm like, nothing made sense, even though everybody else was saying, he must have been depressed. And so really, that was the start of what I, now call accidental advocacy. And never once did we question the drug. We trusted the system. We trusted the doctor, but literally after the coroner said that, my brother-in-law went home, typed in Google, thanks to Google back then, and realized that it said Zoloft and suicide. Little did we know that in 1991, the FDA investigated the emergence between suicide and violence and Prozac. And so they had already been investigating the link between antidepressants and suicide in 91. We didn't know. There were no warnings. And so that became my mission, to get warnings put on the drugs.
First of all, I'm so sorry about your loss of Woody. I cannot even begin to put myself in your shoes and wonder what that was like. I'm sure he'd be so proud of you right now to see what you've done to protect others. I mean, if you just saved one life with your mission and your voice, that's a massive success. But I bet you've saved, getting the black box warning on there, I'm sure you've saved thousands and thousands and countless of lives by that. I would think that there would have been massive pushback because nobody wants to put a warning on their package insert regarding their medication because of how that would affect them financially. And I was just wondering what type of pushback you received when they're probably trying to say that Woody was depressed and that it wasn't this drug. I mean, was that just the fight of your life trying to prove that Woody was not depressed and to prove that it was the Zoloft?
Yeah. So, I like to call it the battle for Woody because initially, it was kind of multi-pronged. Almost immediately, we started going out to DC, Washington, DC, because, there was the UK was starting to look at the antidepressant issue with kids. And then I also had, so that was one prong of it, and going out and meeting with the FDA. The other is meeting with our representatives in Congress. And then from there was also, I had a big wrongful death failure to warn lawsuit against Pfizer, where it was so it was kind of, and telling Woody's story in the media. So I was like, because I work in that industry a little bit, I'm like, there is no way. And so, but yes, absolutely. Everybody kept telling me that Woody must have been depressed. I'm like, no, I'm telling you, he would, like, there's no way he was depressed during this time. Like, he was a big runner, and he kept a running log and how many miles, because he was super anal about making sure he got new shoes every whatever time, however many miles you're supposed to, wear on your shoes. But so during this time, he would always be saying, Kim, I don't know what's going on with my body. I can't run my normal 10, 12 miles. He was like doing 3 miles, and he was doing that all during the time right before. And I'm like, that doesn't even make sense, right? So yes, we went out, and then everybody, like the experts, everybody was saying, oh, well, it must have been depression. And if you look at all the drug ads that were out then, right, it was Zoloft, Paxil, Prozac, and it was all about like depression. Suicide is inherent in the nature of depression. Everything's the nature of depression. And so once you start learning that system, but I think one thing I have to go back, when there's a suicide, or any death, really, any sudden death, I think there becomes this like investigation that, something turned on in me to like try to get to the bottom of something that intuitively didn't make sense. I think back to what he used to always say, I don't judge my life based on how much money I make or my career. It'll be based on my family, my friends, and leaving the world a better place. And I was like, that became something. I'm like, I am not going to let this be the legacy of how you left this world. And so that was really the impetus, because I knew who Woody was. The drug companies didn't. The FDA didn't know who he was. And I remember going to the FDA and meeting with the people who are responsible for the new drug approval for, especially in the psychiatric drugs, Dr. Bob Temple and Lochran. And I met with them personally and told them our story. And he literally said to us, well, this is just an anecdote. It didn't happen we didn't see this happening in the clinical trials. And I was like, what? Anecdotes? Like, this is somebody's life. Like, and then from there, we connected with all these other families. At the time, again, I go back, I was living life, right? So I didn't know and hadn't been following. But, before Woody died, there were some pretty famous, Phil Hartman, who was a comedian with Saturday Night Live. His wife had taken the drug Zoloft, murdered her husband, and then killed herself. So that was happening, and there were lawsuits that were happening. I had no idea. There were little kids, 13-year-olds, that were hanging themselves, that there were other lawsuits. So I eventually connected with these families, and collectively, when there were FDA hearings, we were able to tell our stories one after the next, after the next, after the next, and to the FDA, to eventually get the FDA to put a black box warning on these drugs. But, obviously they had to go and study. They, had to do a meta-analysis. They had to go back and look at all the data. They, used Columbia University. There's so many things that I learned now that are how the system works and who are the people they work with, what academic institutions, So anyways, it's been a huge learning experience, but pushback always. And even to this day, watching, antidepressants have skyrocketed, even though we got the black box warnings on for kids in 2004 and young adults 26 up to age 24 in 2006. We're still like hearing the exact same kind of narrative. And I can't believe prescription rates are like skyrocketing, and people aren't really paying attention to the fact that these are powerful mind altering drugs there's a side effect that called akathisia, which is the side effect that was kept from the doctors. Pfizer knew about it. They didn't tell the doctors. And that was one of the things that we were able to get out from lawsuits, is seeing this behavior that had been happening behind the scenes with these drugs.
As you're telling me this story, I'm thinking you were one of those Americans. You were one of those wives, moms, and we all are, until something hits home. We just go along to get along, and we don't know what we don't know. And that's why I'm so grateful for you. And I'm grateful that you're using Woody's life to fight for the legacy that he is leaving behind. And I think he would be so proud of you, Kim, for what you've done in this 20 years of rewriting his story and rewriting it from a standpoint of hope and possibility and awareness. And can only imagine what this learning curve has been like for you over the last 20 years. I mean, we all are pretty naive. We think all drugs are safe. And I was sharing with you before we started recording that I was a pharmaceutical rep for a little over 10 years. And I sold 2 different antibiotics, and both of them got pulled from the market because people died. And I remember exactly where I was. I was driving in a car, and one of the doctors I was good friends with, he and his doctor, or his partner, in Ada, Oklahoma. And he called me and he said, "Your antibiotic just killed one of my patients." And I thought, I couldn't even speak. I mean, until you hear that, you just think, all medications have side effects, but you think it's pretty minimal. What is the approval process like for medications? I know I did a little bit of research and, learned that there are 3, the preclinical, clinical study phase, and then the new drug application review. But talk to us about that process.
Sure. Well, first of all, it used to be, or at least what I always thought, is that the FDA, we had the gold standard of, drug approvals in the entire world, right? But I have learned that, there's preclinical, there's the clinical, the actual trial where they do animal studies. Does it hurt anybody? Does it hurt the animals? Then it becomes, does it work? Then it becomes safety. Then it becomes, you go through and get approval with the FDA, and then they do some post-market. But the reality is that these, and today I sit on one of the FDA advisory committee meetings, right? So I sit on that committee that in 1991 said there was no link. I sit on that same committee today. And so I'm seeing how drugs come to market, and I'm seeing the data. And now more than ever, we're seeing that the standard, the two double-blinded placebo-controlled studies isn't the norm anymore. Everything is being fast-tracked, and it was during the AIDS crisis. This is what was shocking. And, I have so many documents that I got out from under seal that were internal company documents. And it was during the AIDS crisis when the AIDS population was telling the FDA, you're too slow with approving these drugs, right? And so they put a lot of pressure on Congress. And then that became this whole, back in the PDUFA, Prescription User Fee Act, which I know is going to get really into the weeds, but it's basically that Congress was able to basically the drug companies pay the FDA to approve their drugs, and it was to help expedite the drug approval process. So that was one thing. It was just, how do we get drugs on the market faster? Then now, subsequently, there's all these other pathways that Congress has approved that to get these new drugs, like even some of the Alzheimer's drugs, the fast tracking of even the COVID vaccines. Everything is faster. But, I've come to realize, my background, you worked for pharmaceutical company. I have been a marketer. So I have a very unique lens. I have been marketing my whole career, advertising. And so even when I sit on the FDA, I see things differently. I see it from the lens of like, wait, the whole game is all about, because all the FDA's job is to approve, is to actually look at the medications, look at the, the studies. The studies are not designed for safety. Because, you think about it, it's the business. You need the FDA to approve your drug to get it on the market. And then you can sell, then you can give it to people, when your old position, and start marketing it. We're one of 2 countries in the world that allow drug ads. And so that whole system is kind of controlled by the pharmaceutical companies, and it is to get on the market. And everything is, if you listen to advertising, listen to the marketing, safe and effective.
Yeah, they say that all the time in the commercials. And I think what you're doing as an advocate and just speaking the truth, you're educating people just so that they know what's going on. And I didn't realize, I didn't realize that there was this fast track program. And I also believe that once you open a door like that, you can't close it, or it's very hard to close it. So once drug companies have gotten used to this fast track program, and I'm sure they can justify this, I know that there are certain requirements that a drug has to meet to fit that fast track program. But man, once that door is open, I would think that would be incredibly hard to close, because on paper, that sounds good, right? Fast track it to get it to patients that you could possibly save somebody's life or what have you. But in my research, I've learned that actually more patients have been harmed than help. And I believe that when I was researching your story, I read that, and it's just so alarming to me that not many people. And here I was a pharmaceutical rep, and I didn't even know about that until, just a few days ago.
And it's interesting. I actually went and did I was invited to present to a pharma marketing conference, and it was to tell the patient perspective. But little did they know, like, as I got up there, I go, you guys, I'm one of you. I'm literally one of you. And so I know that there are a lot of things that are happening in the background of the company, that you're being given this information and you're going out and marketing, or you're like, everything's like, oh, it's to help the patient. But is it like, we talk, safety is a really important thing, but safety is not something that the FDA wants to talk about. And they'll just throw it in the, the commercials and the marketing, like, oh, like it might cause blah, 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 on the end of the commercials. But that you have to actually realize those are people's lives. And, like I've also started to understand that the drug companies, the way they work is there'll always be, drugs they create an effect, right? I mean, that's why they're a drug. Sometimes it's a benefit, sometimes it's a harm. But when you look at the harms, I've come to realize that people like Woody have become acceptable collateral damage, like the cost of doing business. And there will always be, like your doctor who called to tell you about a patient of his that died, that's called, oftentimes it's just acceptable collateral damage. And, these are somebody's love.
Yeah. Somebody's mom, somebody's wife,
somebody's kid.
Yeah. And it's just not acceptable to even use that word. Drugwatch.com stated that in the 1980s and the 90s, the FDA began new programs that fast tracked them. But in Europe, the regulatory agencies require more of a review process for safety and efficacy before insurance plans will even pay for the drugs. And we not only have the shorter timeframes, but also have accelerated approval in the fast track program. Why has Europe been able to kind of keep these things at bay and maintain these slower, more safe approval processes?
Well, one thing I know is that they require more than just in the normal process, like where the double blind, they might require multiple studies. So I think that's one thing. I think the fact that they have government pays for, drugs, and pays for the medications, that I feel like that's another reason, or at least that's what people tell me, is that because governments are involved in the actual paying, unlike ours, which is kind of a free market, that there is a little bit more emphasis on, does the drug work and is it effective? Or does it work? Is it effective? And is it safe? And if you look at a lot of the issues like this antidepressant stuff, it came from the UK, right? They were the ones that flagged it. I have seen this like in even some of the things right now that we're seeing with the COVID vaccine. It's other countries that might be flagging stuff and alerting the FDA, but are they actually doing anything with it? And so, that was I have a whole platform that I actually talk about now. It's called Selling Sickness. And it came literally what I realized, because I love to travel and I would go to all these countries and learn. I mean, just use it, as learning. And I'd go to these conferences, and there was a conference that was like, it changed the way I looked at everything. It was in 2010, and it was called Selling Sickness. It was put on by the Dutch government, and nonprofits called Healthy Skepticism. And it was attended from people from all over the world. There were a handful of us from the US, and every example that they were using were from the US. And they were like the issues with antidepressants, the Vioxxes, and just the system, and the marketing. And I was like, why isn't this happening in our country? And so I realized there's a lot more attention paid to this concept of, do the drugs work? Are they safe before they come on the market? But we have a free market, which, is how our system has been built. So.
Yeah, that's so fascinating that Europe kind of was to blame in a good way, and they were the ones to break the story and to expose this. And I mean, really, the United States at that point really had to respond in some way. But I'm grateful for their procedures. I'm grateful that they did expose that. Well, according to drugwatch.com, taxpayers provide about 1/3 of the FDA's funding. But the agency receives a majority of its drug review funding from big pharma, the very industry it should be regulating. Isn't this a conflict of interest?
I would say the fox guarding the hen house. It is. So that was all during that PDUFA, Prescription Drug User Fee Act. And that was set up to help expedite the FDA approval process from the drug company's perspective. So with that, it means every application, new drug application, the companies pay a fee for the FDA to review their product. So really you wonder, and I've been doing this work, and I do a lot of work with trying to improve the FDA. If they're paying it, who's their customer? Like this Prescription User Fee Act that I was telling you about is something that needs to be approved every 5 years. So it is something that most people don't even pay attention to it because it's out there. But in there is a lot of things that impact how fast drugs come to market, whether or not, and the industry is dictating what things they need as part of that approval process, because they're paying their fee, and that's what they call the negotiations, and then it has to get congressionally approved, and then ultimately goes up to the president for signature. This is all. I mean, even I have to be honest with you, we just had the reauthorization of it 2 years ago, right in the middle of COVID. And I was like, oh my God, who's paying attention to what is happening with PDUFA out in Congress? Because we're so focused on COVID right now. And sure enough, there's things that got slid through and nobody's paying attention. And so, that was for me, when I learned that the FDA gets paid or the industry pays to have the FDA review. And I thought, our taxpayer dollars did it. So I know that there's been, ideas flown or, communicated out there in the past, like, why don't we take all the monies that the drug companies are going to pay and put it and let it be not go directly to the FDA, but maybe into a fund that helps to, offset some of the expenses at the FDA. But the reality right now, it's Fox guarding the hen house. And the real customer, even though you look at the FDA's website and they say their mission is, public health, I really believe that they have more focus now more than ever on working for the industry versus for you and I, the everyday person who goes in and takes, trusts and takes a pill that we assume has been thoroughly vetted.
And even if it weren't an influence, it shouldn't even look like that. Obviously, how could it not be? But even if it weren't, it just looks bad in business. In medicine, of course, gosh, you want to be above reproach. You want to look very clean. You want to dot your I's and cross your T's when you're talking about human lives at stake. And just to learn that, again, I as a pharmaceutical rep, I never even knew this. And so it was just so disturbing to me. I'm sure a lot of other people don't know this either. And just the blaring and glaring issue here, this conflict of interest, I'm just so shocked that it could perpetuate for all these years and nobody seems to have a problem with it. What type of action could our legislators take to help fix this broken system?
Well, one thing that I have been advocating for a long time is the people who approve the drugs are also the same people who are responsible for safety. Like, it's the same group. And so I think we need to separate out approval from safety and have it a completely separate job, because, I always say safety is my top priority. And if, just that is one thing. I think taking, I would love to see drug ads go away. It's my industry. But, I don't think that we need to have drug advertising personally. I'd like to see that go. I do think that we need to look at this idea of the fast tracking and really look at do an analysis. Is it, everything is under the guise of for the patients, but the reality is the patients are consumers. And I always say we're customers, and it's how they go to business. So we have to almost, it's not an either or. I think there's like a white. It's not black or white, it's gray. It's kind of both and. So we need to have people like, the harmed victims. And I always say the harmed because it's usually those that have gone through and investigated and have that perspective, have a seat at the table. Everything right now is always about innovation and getting more. So I think that is something that our legislators can do, is really look at some of the programs that they've created to help fast track products to market.
How has that been received? Do you see that legislators are interested and open to these options?
No, I don't, not really. The one that I think we could really be pushing for is the separating out of safety from approvals. I think that has to be something. It just makes sense. That has always made sense, because right now, if an airplane goes down, we don't look at who approved the airplanes. We have a separate group that goes in and investigates and looks at everything. And that includes the drug, the black box. That's why you have the black box in the plane. I want that same kind of system for drugs, something completely separate. But there's so much until we get the conflicts out of medicine. And it's not just at the FDA, it's at our academic institutions. It's at the CDC, it's at, it's the lobbying, it's all the advertising, it's the PR, it's, it's on and on and on. I call it the spider web. It's all of that until we get the conflicts of interest out of medicine. I think we're going to continue to run into these problems. And that is why it's really important that we are our own advocates and do our research.
Well, that's a perfect segue to the next question. And that is, what can we as moms, I mean, we're called Moms on a Mission, but I mean, really, this is for any American, any human being. I mean, we should be advocates and we should be pushing back against this. I mean, what would be a call to action item for just a regular mom or dad or any American listening today?
Well, I would say, first of all, if you see something that you don't think is right, believe that you as one person can make a difference. So I will say that, like, I'm a big believer in that. So if something doesn't make sense, instead of sitting back and watching things happen and you can get involved, however little or big it is, but just saying yes, I think is really important. The other thing is advocating. No one's going to know your child or your loved one or your parent, better than you. And no one's really your advocate other than you. And so if you have that mindset going in, and really being almost, if you're going to have to, with your doctors, being a partner with them. But, I always say, if they tell you to take a medicine, just, I always stop, pause, be curious, ask questions, and don't be afraid to push back, or if something doesn't intuitively make sense, really listen to that. I wish that, looking back, I wish I would have taken, when Woody was heads outside the body, that just intuitively doesn't make sense. And I wish I would have asked the questions. I wish I would have pushed more. And so that's one thing I think we can do, is never give our power away to, the doctor or the FDA thinking, oh, well, they've got our best interests in mind. Even if they are doing the right thing, thinking they're doing the right thing, even our doctors don't know, the system. And so don't give your power away and be your own advocate is something that I think is really, really important, especially in the context of medicines and things that we're taking.
I think that's so critical. And, there is a reason why they say, a mother's intuition, right? So, and if you're a believer, it's the Holy Spirit, the Spirit of truth will warn you of things to come. And he puts a check in your spirit for a reason. And so we need to listen to that, whatever that is, and follow that leading and that prompting. And, we just know if something doesn't add up, it doesn't make sense, that's from the Lord. And I think moms really do it best. We know when something is just not right, something's off, and you take your kid to the doctor and they send him home or her home and say, she's fine or whatever. And you're like, no, this is not like a normal whatever, that something seems wrong, and just going in and pushing and pushing and pushing. And I think that moms and parents and folks are waking up a bit more to this, that it's not just as simple as whatever the doctor says is right. I believe that people, and I want to believe that people, and moms in particular, are pushing back and asking questions. And I mean, it is great that we have the internet. I mean, we can Google different drugs. We can Google the class. We can get on Facebook and ask questions if anybody's had an issue with this or that. So we do have ways to ask questions and to be an advocate, not only for our families, but for our own health.
Yeah, absolutely. I think, again, it's what I have learned. I know I gave my power away back then, 20 years ago. Now, today, very different. And even when people come and ask, or my parents, I'm always asking them to ask questions. Or even when I've been in the doctor and they're telling me something, I'm like, well, do you know that these drugs have lawsuits? And they're like, I just love asking that one, because I don't think, I think, and I always tell the doctors when they say that, I'm like, no, I'm telling you, don't be afraid of these lawsuits, because I know you might be because you're a doctor, but there are so many things that you don't even know. And so I'm always asking that, but pushing back. But I think that makes us better. I think that makes us better in a partnership. If, especially when it comes to our health, asking, look, especially like antidepressants. I wish I would have said, are there other things we could have done? Are there other things? What should medicine really be the first place that we start?
Well, and I have to speak as a rep calling on doctors. I mean, they're so busy, especially if they're family practice. They are dealing with so many different disease states. And it's probably incredibly hard to stay up on various lawsuits. You'd think, though, that they would get an email or something from the drug company, or you'd think there would be somebody watching who would communicate these things to them, because that's super important. But for them to have time and just look up every single one of their drugs they prescribe to see if they're lawsuits, I mean, that would take them hours and hours. So it'd be great if there were a company that did force these drug companies to communicate with the physicians and let them know. Kim, I just can't thank you enough for coming on today and sharing your story about Woody and the 20-year anniversary in August. I mean, wow, that's probably seems like a long time, but yet it probably feels like it wasn't that long ago. I'm sure that left such an imprint and that an empty hole in your life that you've had to live with for all these years. And so I just want to say thank you for coming on the Moms on a Mission podcast and sharing his story and really creating such an amazing legacy that he would be so proud of, that all the work that you've done. It's not lost on me that your background is marketing. I think it's kind of God's sense of humor that he's putting a marketer in this situation to expose the marketing problems with our medicine. So thank you so very much for coming on. How can folks find you, follow you, and connect with you?
Sure. They can find me at kimwitczak.com. And I have a Substack, Acceptable Collateral Damage at Substack. I also am on Woody Matters website, as well as Twitter, or whatever the new X is, at Woody Matters as well.
And Woody, Woody, and then Matters, Matters. So Woody Matters. I love those names. Again, I think that's so neat how you're keeping his memory and his wonderful life alive, and his message strong and loud. And I'm so grateful for the work that you're doing, because not only are you helping to preserve his legacy, but you're literally helping to save thousands of lives. And for that, I just want to say thank you.
Thanks for having me. I appreciate it.
And we're going to have Kim back. We're going to have a part 2 and talk about some other things, but I just wanted to have her introduce herself today and share her story about Woody and her advocacy successes. And then we'll talk about some other safety issues later down the road. But thank you, Kim, for joining us. And thank you, moms and dads and everyone who listens. We do not take that lightly, and so very grateful for your listening and your support. If you go to momsonamission.net, that's momsonamission.net, and fill out your information and leave your email, we can connect with you that way. And then if you have any comments or questions, we would love to hear from you. And you can email us at moms@momsonamission.net. That's moms@momsonamission.net. And we'd be so honored and thrilled if you followed us on your favorite platform. We love Rumble because it's uncensored, but we are on all platforms. So thank you so much for following us, and God bless you, and have a great day. In light of recent bank volatility and skyrocketing inflation, diversification is a must. That's why I use my good friend Andrew Sorcini at Beverly Hills Precious Metals. Beverly Hills Precious Metals makes it so easy to diversify. I personally ordered some silver and it arrived on my doorstep just a few days later. They make it so easy. And if you're not ready to do that and you just want to ask a few questions, they're there for you too. I personally got some silver and also am rolling over some of my IRA. You can actually roll over your IRA and have it be backed by silver and gold. So if you don't have any extra money to invest in silver and gold, rolling over a 401k or an IRA, or even part of it, if you just want to try it at first, just for a little bit, you can do that as well. So go to bh-pm.com today and ask all your questions. You can connect with somebody. And like I said, you can just get some information at first if you want and pray about it, and then get back with them to roll over part of your IRA or all of it, or order some gold and silver. That's bh-pm.com. and tell them that Moms on a Mission sent you. Hey, everybody. Did you know that recent research from the CDC says that millions of Americans develop parasitic infections and symptoms often go unnoticed or are misdiagnosed? Parasites are actually the cause of many health problems such as anxiety, depression, chronic pain, fatigue, and unexplained digestive issues. We all need a common sense strategy to improve our health. Moms on a Mission encourages you to reach out to our good friend, Dr. Jason Dean. Dr. Dean's Full Moon Protocol provides all natural detoxification and fights inflammation. And the supplements are made with 100% organic ingredients and are proven to kill parasites safely and effectively. I know after I took Full Moon Protocol, I had more energy. To order your Full Moon Protocol today, go to bravetv.store/mission to save $20 off your first order. That's bravetv.store/mission. According to leading sleep experts and sleephealth.org, over 50 million Americans struggle getting a good night's rest. That's why Moms on a Mission loves MyPillow. MyPillow makes amazing pillows, sheets, mattress toppers, robes, towels, literally almost everything you need for a good night's sleep. They also make dog beds for your dogs. So by going to mypillow.com, typing in the code MISSION, you not only receive a high quality product, but you're supporting Moms on a Mission and this podcast. If you like what you're hearing and you agree with it, you believe in it, and you want to support Moms on a Mission, then go to mypillow.com today and order some high quality products and just type in the code MISSION at checkout and you can save up to 66% off. That's mypillow.com, code MISSION.
Since 2014, Organic Body Essentials has offered clean, simple, certified organic skincare. Our organic face-to-feet and federally compliant hemp and pet products are manufactured under USDA and FDA guidelines. Our products are inspired by God using plants He created. In Ezekiel 47:12, it says, "The fruit is for food and the leaves for healing." We believe in the power of God to heal, so we pray over our products and for our customers. Our therapy in a bottle approach has been widely received, and our customers' testimonials continue to inspire us. You can find us at organicbodyessentials.com and obe.organicbodyessentials.com. Please feel welcome to reach out with questions. Use coupon code MISSION at checkout for a discount. Thank you for your support by using MISSION at checkout to benefit Moms on a Mission and their quest to reestablish traditional values in our education system and empowerment for a healthy lifestyle.